A lesson wrap-up is required and a must at the end of each lesson. The wrap-up allows for instructors to determine skill proficiency, content knowledge, and allows participants to ask questions. The wrap-up effectively bridges from one topic to the next topic. At the course conclusion, there are end-of-class activities, certification assessments, and written exams. End-of-class activities allow participants to make crucial next-step care decisions and build confidence in their ability to utilize what they have learned. Successful completion of course conclusion activities and/or assessments are required for certification. In some programs, this is the final exam and takes the place of the written test. It allows instructors to evaluate skill competency. The written exam for the First Aid, CPR, AED course is administered when required by the client. For example, the participant's employer requests this. The practical assessment and written exam are required for the BLS course. The simulation, blended learning training, any exams are completed during the online portion of the training. Use the instructor's manual for information about requirements for class completion. End-of-class activity is the first aid game of chance. Participants are divided into two teams and complete the following. Dice are rolled to determine the categories. Category 1, true or false. Answer a true-false question. Category 2, what should you do? Participants tell how they would respond to an emergency. Category 3, show me how. Participants demonstrate the skills needed to care for the victim. Category 4, sequence the steps. Participants identify the correct order of the care steps by sorting index cards. Category 5, short answer. Participants answer a short answer question. Rolling a 6, instructor wildcard. The instructor chooses a question from one of the categories. If a participant wants help, they can ask a teammate to be a lifeline, and the two can work together. Game is played until all participants have the opportunity to answer at least one question. Written exams. Red Cross curriculum is generally skill-based, and many classes do not require written exams. Basic life support, CPR AED for the professional rescuer, lifeguarding, and emergency medical response do require a written exam. For classes that require an exam, the Red Cross standard for success is 80% correct. Instructors should be prepared with Test A and Test B, and students who do not pass the exam on the initial attempt should be offered the alternative exam. Oral exams are also an acceptable option. Written exams for classes where it is optional should only be given when requested by an employer or organization. If an employer or organization is asking that the exam be administered, it will be noted in your addendum and should be mentioned when you are confirming your class. The instructor's manual for each program will provide all the criteria for exams and certification. Please note, if an optional written exam is requested by the customer, successful completion of the written exam is not required to receive certification. Participants meeting all the required course criteria should be marked successful and are Red Cross certified. Not successfully completing an optional exam may not meet the employer's requirements, but Red Cross will issue a certification. Although infrequent, there will be participants who are not able to successfully complete the requirements for certification. Give participants the opportunity to be successful. If possible, offer time during breaks or after class for additional skill practice or to answer questions. When a participant looks like he or she may be struggling, begin providing feedback and additional support immediately. Use strategies such as simple language, breaking down skill components, and extra practice to help participants learn. Be sure to follow guidelines specific to each curriculum for retests and so on. If a participant cannot meet the objective, encourage them to stay and participate in the remainder of the class. If a participant fails some but not all the components of a course, document in detail what was successful versus what was unsuccessful on your course record or roster. Participants will be issued certification only for those components that were successfully completed. Report immediately to your supervisor, as well as documenting on the after-action report in detail why the participants were not successful and what additional assistance was provided. Contact information for the participant, and do not promise the participant a refund.